If you're going to get a breast augmentation, listen to this video. Going into your consultation, you want to ask your surgeon, what kind of implant am I going to get? And that's a very common question that everybody asks me when they come into the office for this procedure. It's a good question because there's so many different types of implants. There are different manufacturers. There's round implants, there are teardrop shaped implants, there's textured, there's smooth, there's silicone, gummy bears, saline, all these different types of implants that have been used, some of which we don't use anymore. But it's very confusing because as a patient, you don't really know what type of implant is going to be best for you. Usually surgeons will choose a brand or a type that they like, and within that brand or type of implant, because it's easier to work with a certain type of implant all the time. I myself use a brand called Allergan, also called Latrell, and specifically I like to use a silicone soft touch implant, which is a smooth round implant. The reasons for that are I really feel I get the best results with that type of implant, and I've been using round smooth implants for about 20 years now. Every surgeon will have their preferences, and I think it's important once you pick your surgeon to still ask this question so you know why he or she is using a certain type of implant, just for your understanding, so that after your surgery you don't have to ask your question, well, should I have gotten this implant or this implant, because you'll know why that implant was selected for you. I like the type of implant that I choose because it gives the best shape, it has less rippling, it feels more natural. All those reasons have led me to choose that implant for almost all of my patients. Now, I may have patients who want a certain type of implant. I'm happy to do that for them if they want, but if it's left up to me, my preference is for a certain type of implant based on my skill and experience. And I think that's a good way to let your surgeon guide you to the best choice. You may hear that one implant is better than the other on either social media or somewhere on the internet, but I would really shy away from that because one person's experience may be very different from yours. Their situation may have led them to have that implant just because it was right for them and may not be right for you. In addition to the type of implant, there's also something called profile, which is how wide the implant is relative to how much stuff is inside. I explain it kind of like a shoe. Sometimes you have wider shoes, narrower shoes, all the same size, but they're just designed for different bodies. Implants are pretty much the same. It used to be that everybody got the same profile, same width of implant, and that led to a lot of women with wider implants. I routinely see women who had their surgery 20 years ago, for example, and too wide an implant was placed just because that's all that was available. Nowadays, we have all these different profiles, different widths of implant. So even though, let's say it's a 400cc implant, I can select a narrower implant or a wider implant for a woman's anatomy. And that's really what a surgeon should be thinking about when they're choosing an implant. You want the implant to fit the look, the patient. All those things are critical to give patients the very best result. So it's another good question to ask going into surgery. What kind of profile am I get and why was that selected for me? I think along with the type of implant, the profile implant, you want to ask what kind of anesthesia I'm going to get. I think it's, in my opinion, this procedure should not be done under local anesthesia. So you have a difference between general anesthesia and local anesthesia. General anesthesia is you're just completely out. You're asleep, you go to sleep, you don't know what's happening, you wake up and everything is done. And I really feel that that's how this surgery should be done, properly and safely. There are a number of different steps that have to occur when an implant is placed in the chest. If the implant is placed underneath the muscle needs to be cut, and that can be a very uncomfortable sensation and feeling if you're awake. And I have seen this done when people are awake, and it's not the best way to do this. In addition, surgeons gotta sit you up in surgery, at least I do, some surgeons don't, just to examine the breast for symmetry and position. And you can't really keep sitting a patient up and down when they're awake. They really should be asleep for that maneuver. And patients will move if they're not completely asleep. Can't stay still all the time. And when you're under sedation, which a lot of patients do get under local anesthesia to make them tolerate procedure, they move around even more. And movement during surgery is not good. Surgeons should have a completely still patient when they're doing surgery on them. And especially in a larger surgery like breast augmentation, any movement I think is just bad for the surgery. So I would strongly suggest that a patient gets general anesthesia where they can breathe out versus one where they're partially awake for at least a breast augmentation. There are definitely procedures that I would do under local anesthetic if they're smaller, such as liposuction or eyelid surgery, where a patient can stay still for a shorter period of time. It's not uncomfortable, and that's fine. But something like a breast augmentation or even a tummy tuck or even something even bigger than that, I think it's really much better to be completely under. So I hope you enjoyed this video. Please smash up the like button, subscribe to our channel if you like content like this. We'll see you next time for my next favorite surgery, which is a tummy tuck. And I'm going to explain everything you need to know about a tummy tuck before you get one.